doctors think. It's a little controversial. There's a lot of different opinions. But this is a new study out of Canada. It's published in the British Medical Journal, and it's a 25-year study that tracked nearly 90,000 women between the ages of 40 and 59, those who had annual mammograms and those who get regular breast exams. And what this study found is that mammograms do not reduce breast cancer death rates, and that in fact more than 20% of the women that had the mammograms or exams were overdiagnosed and may have had unnecessary cancer treatments. So what does this all mean? Dr. Carla Simonian is an OBGYN at Hackensack University Medical Center. That's a lot of information. I mean, what's the big takeaway for any family out there hearing this news today?
Okay, so this is a very emotional issue for women, of course, but the takeaway is that most cancers that are diagnosed by mammogram, I don't want to say cancers, tumors, are not necessarily those that are going to decrease your life expectancy. Some of them even regress on their own. So what they found was that although mammograms are great at picking up cancers and tumors, it's not so great at saying that you are going to actually eventually die from this cancer.
Interesting. So what does a woman need to know if she gets a diagnosis that says you do have a tumor, it was discovered on the mammogram? Is there a set of tools that we should have to ask further questions about what you just mentioned?
I mean, there is. You know, when mammograms diagnose something, a doctor is going to feel that he or she has to intervene. But the point of this study was that maybe we shouldn't be diagnosing these so early on. Maybe we shouldn't be looking for them, actually, at age 40. Maybe what we can do instead is wait until age 50, when it's more likely that what we pick up is going to be, you know, an intervention at that stage is going to be necessary.
But the American Cancer Society points out that when there are aggressive forms of cancer in a woman in her 40s, they can be particularly deadly. And for those women, the mammogram may be life-saving.
Absolutely, and that's why for each patient, you have to really tailor it. You have to look at her history, you have to look at her risk factors. I mean, for you or for me, we may have to begin mammograms at a very early age, but someone else may be able, with no risk factors, no history, may actually be able to wait until she's about 50.
Now, I have a history of breast cancer in my family, and so I'm really paying close attention to the ages because I was told very early on, I will have to be screened because of the history with the family. In 2009, though, there was this task force that came out, and it caused a lot of controversy because it was right around the time of the new healthcare law. And this is a government panel that said, really, maybe we shouldn't be doing mammograms until age 50. But for so many women, you know, when you hit 40, it's time to get a mammogram.
It's time, it's ingrained. And
so what about the age? I mean, is there really an age that should be set for this?
I mean, right now, I think women should do exactly what their OBGYN or breast cancer specialist tells them. If they say start at age 40, which I think most doctors are still going to tell their patients, one study, they're not going to change everything that they're doing. Keep getting your mammograms early, every year at this point. However, you know, I think that for the future, when insurance companies see the cost savings, you know, in this healthcare environment that we're in, they're really going to push for age 50 because of this data that's coming out.
But do you think that's true of a lot of preventative medicine right now? If we looked at cancers like skin cancer, for example, or prostate cancer in such a wide study, that they would find very similar results, that 20% of the people have procedures that may not have been necessary?
There's always a certain element of the patient population that's going to have interventions that were never needed. We don't have a crystal ball. So, you know, a lot of these studies look to see, is it worth, you know, screening a huge number of people to find X number of cancers or disease? And that's really what, you know, what's very tricky and very difficult. So, you know, particularly with breast cancer, there is some data saying maybe we should wait until 50 so that we're not picking up things that really weren't going to harm us ultimately.
It's fascinating. Doctor, it's great to have you in today and your expertise. We really appreciate it.
You're welcome.
Thank you very much. John?